The broadcast is now starting. All attendees are in listen-only mode.
Hello, good afternoon. We are getting ready to start here at about 2:30 for the pre-application webinar for RFA 2021HCA2. So we will get started in just a couple minutes. Thanks for joining. We'll be right back.
Muted.
Hello, good afternoon. It is 2:30, so we are going to go ahead and get started, though I still see some folks joining. So I will do a slow introduction while people get on. Thank you for joining today's pre-application webinar for RFA 2021HCA2. This is for the community-based organization grants for both the dedicated marijuana account and the mental health promotion grant. As a quick reminder, applications are due on March 26th at 2 p.m. I am Alicia Hughes. I am a supervisor here in our Substance Use Disorder and Mental Health Promotion section in the Division of Behavioral Health and Recovery at the Healthcare Authority. In my role, I oversee our community-based organization, or CBO, grant initiative, and my peer supervisor, Jen Hogue, also oversees our mental health promotion and suicide prevention work. She is not on the call today, but we will be answering any questions in her absence. Today, we'll do a quick overview of the technology, so we'll go to the next slide as we get started. Next slide, please. Heidi, please move to the technology slide. Oh, one moment. Sorry about that, folks. All right, we're getting the PowerPoint back up. One moment, everyone. As I can do a quick overview. So for technology, it's always a good idea to close other windows. If you're calling into the webinar via phone, make sure you click the telephone button and enter your unique audio PIN if you have not already, so that you can raise your hand and be unmuted if you have a question at the end. If you do have any issues with the webinar today, please email Heidi Jones, and her email is heidi.jones@hca.wa.gov. As a quick reminder, this webinar is being recorded and will be posted on the HCA website for this RFA. And so because of that, please do not share any confidential information. We will also, again, we have the Q&A session at the very end after we go through some slides on the actual RFA. And we will get to as many questions as we can when we do get started. However, we know we won't be able to get to all of them. And we will make sure that anything that we do not get to in this webinar will be added to the Q&A that goes out in the amendment posted later this week. Having some issues with the PowerPoint. Sorry, folks. Apologies, everyone. We're trying to get the PowerPoint back up. We lost this. Okay, I think we're back up. Thank you, Heidi. Next slide, please. Great. So for some webinar controls, you have a grab tab that allows you to open and close the control panel, mute or unmute your audio, as well as raise your hand. We'll talk about raising our hand on the next slide. And then there's also a questions pane, and that allows you to submit questions and review any answers on our end. And then we'll be reading those at the end, like I mentioned. Next slide. So how to raise your hand. We can all take a quick practice at this. You'll see your little hand. You can hit that green button and it'll go up. Everyone wants to practice that. I see a bunch of green hands coming. Nicely done, nicely done. And then put them all back down. And that means you do not have a question. So we know that many of you will have questions as we get to the end. You can leave your hand down for now until we get to that portion after the slides today. Next slide. And then just to make sure we can hear you, if you do want to come off mute, make sure you go to the audio and use your unique audio pin. All right, next slide, please. Thank you. So for today's webinar, we will go over the intention of the RFA, what our goals are for funding these sites. We'll explain the two funding sources, the state dedicated marijuana account, the mental health promotion project, suicide prevention money. We will go through the required sections for what is needed for the RFA, as well as do a question and answer session at the end. So purpose and background. Our goal here is to increase capacity to implement direct and environmental alcohol, tobacco, opioid, and other drug prevention services in high-need communities. And then with our mental health promotion project, we want to make sure that we can do some of the additional direct service work through the mental health promotion and suicide prevention project. We do encourage organizations and applicants to partner with existing community prevention and wellness initiative coalitions or other community coalitions. The goal there is to ensure there's a collaboration within a community, avoid duplication of services, and leverage the existing prevention resources that exist in a community. HCA does reserve the right to negotiate with the apparent successful applicant, or ASA, as you've noticed in the RFA, for both your project scope, which might mean the number of proposed individuals served, as well as funding amount. We'll go into that in a little bit later. We will also have consideration around community geographic location to make sure that we have a solid distribution of projects statewide, that will take into account the high needs of each community that is proposed in each application, and then take into account any past performance of HCA or DBHR contracts if you are an existing contractor with us. Next slide. So here's our current timeline. The applications were released on the 22nd, and as we mentioned, they are due on March 26th at 2 p.m. That 2 p.m. reminder is different than usual. Sometimes it's the end of the day, so just a reminder, it's 2 p.m. Questions are due each week by Thursdays at 4 during the whole RFA period. So we had some questions due on the 25th, and then March 4th, March 11th, and March 18th. That means you may ask questions only in writing to the HCA procurement coordinator, which is Heidi, and we will respond to those the following Monday by 5 p.m. So this Monday we'll answer any questions that came through by last Thursday. Any questions we do not get to today will be posted by March 8th, and so forth. Today is our pre-application conference. Applications are due on the 26th. There'll be a period where our team evaluates applications, and then we'll be talking with the apparent successful applicants and notifying them via email, as well as to the unsuccessful applicants by the end of April. There'll be a few weeks there where we're working on contracts and holding debriefing conferences if requested. And all of these grants, both the GMA and the MHPP, will end on, we'll start on July 1st. And I do want to mention, we had some questions come in last week that we are, like I said, will be posted by the end of the day today. One of those was around an error on the CPWI community list, the existing CPWI site. So we know that there's a couple of errors on that, and that will be corrected. Just wanted to point that out. Okay, next slide. All right, so here are our eligible entities. As a reminder, we do encourage entities applying to partner with existing CPWI coalitions. We will fund tribal government, urban Indian programs, government organizations like county governments, cities, local governments, special district governments, law enforcement agencies. There's a group under educational organizations, school districts, educational service districts, public and state-controlled institutes of higher education. I do see a question in the chat box, so hopefully that answers that question for you. And private institutions of higher education as well. And then nonprofit organizations that have a 501c3 status from the IRS. And those are, youth service agencies, hospitals, faith-based organizations, etc. And we did have I will also answer a question that came in last week regarding, well, let's come back to that. Sorry, I'll do that in the Q&A section. Thank you. So type A applicant. So in an effort to work through some of our challenges that we've heard from feedback in prior RFAs, HCA made a change to have two types of applicants. We have type A and type B applicants. And type A applicants are those who have an existing community prevention and wellness initiative, or CPWI, or community-based organization grant with HCA and DBHR. So you're already existing in our system. You may be an existing subcontractor under an existing CPWI or CBO. Or you may have held a contract with HCA DBHR. Maybe it wasn't specific to CPWI or CBO, but you have you understand the HCA DBHR contracting system. You've been in our online reporting system before. You know kind of all the bells and whistles of our contracts, and therefore you're a type A applicant. Then we also have type B applications, and the type B folks. Next slide. The type B folks are those who do not have an existing contract or subcontract. You are new to applying for an HCA DBHR grant, and or you may also be a tribal government or urban Indian program and have that agreement with HCA. And the goal here is that we want to try to equally distribute funds between type A and type B applications. We do reserve the right to fund applications more in one type over the other based on score and other factors that we deem appropriate. But we do try to have the as much as we can, we'll try to split the funding amounts between both Type A and Type B to allow some equity in new organizations and entities applying for HCA DBHR grants. As you will notice, Type B slide, please. Thank you. As you will notice when you go through the application, there are some slight adaptations to those who are applying as a Type B. For example, your action plan that you will complete for this application has a little bit of differences than the Type A application. The primary point being that if you're Type B and you're new to our system, you don't necessarily understand all of our fancy language that we use for some of our prevention work. And so we will work with you to get your paperwork and action plans and budgets in a certain order as soon as you come on board if you're notified as an apparent successful applicant. But you will notice that there's a few changes there just to make it more equitable for applying for that. And so I'm going to pause for a second. We're going to do a poll, and I want to see if you can say you're a Type A applicant or you're a Type B applicant. And so Heidi is going to launch that. One moment. Okay, Heidi, you can probably close the poll if you think we've had a good number. Thank you. All right, we can move on to the next slide. So as a general overview of our projects for the CBO grant, we do intend to award multiple contracts to the eligible entities to provide quality and culturally competent evidence-based programs, research-based programs, and promising programs to address substance use prevention and mental health promotion programs or suicide prevention projects. With these, we are not excluding any organizations from applying, but are giving priority to organizations that are listed on the high need communities list in Exhibit D. The goal here is that we're providing those prevention services to the highest need sites around the state. We have a risk ranking process that we complete here on our end every year to update that list to identify the next eligible high need communities. And so they will receive priority points in the application, but we're not excluding any community from applying. Next slide, thank you. There are some things that we added into the RFA that are considered absolute priorities. Those are things that are scored during the evaluation of applications and are deemed the highest priority to include for favorable consideration in the application and evaluation process. These things include providing direct services by expanding prevention programs, including both youth and parenting, evidence-based programs, research-based programs, promising programs. Another priority is using multiple strategies to meet the need of a direct service. Implementing a recurring cycle of programs, for example, you propose that you have multiple iterations of an evidence-based program that are going to be occurring throughout the year, as opposed to just one implementation cycle. Selecting an evidence-based program or research-based program that reaches priority populations and those high-need individuals in your communities. Another priority is thinking through geographic limitations, keeping in mind geographic limitations, serving a high number of individuals through the direct services. And while we do allow some information dissemination, public awareness, social norming type programs, we are really focused on reaching people through those direct services, be it virtual or in person, of course. But we will still allow those other strategies to be implemented. In addition, applicants can earn additional preference priorities points for direct services if you are a high-need community, that's listed in Exhibit D, or collaborating with an existing CPWI site to provide those direct services. And as I mentioned before, the goal there is that we can avoid duplication in communities, we can encourage collaboration, really support and leverage those existing prevention infrastructures that exist. Lastly, our highly valued priorities. We really do want to mention our goals here are to meet the needs of underserved and high-need communities throughout the state. And so we do ask in the application, describe the demographics of the community that you're intending to serve, describe why there's substance use disorder or mental health challenges in the community. What are those needs so that we can really shoot to support these underserved communities throughout the state. And then we do want you to consider, while you're selecting your direct service programs and strategies, thinking through the costs, the intended reach of those programs and strategies in your application, what makes most sense for each high-need community based on geographic scope and size of your community, et cetera. And then other things to know, I mentioned this earlier, we do have HCA reserves the right to work with applicants to refine or adjust proposals to fit the objectives of HCA and DBHR. We do want to see a recurring cycle of direct services. So for example, thinking through adjusting a project scope, we may have a budget that is submitted. There might be a couple of items in there that technically do not follow some of our funding guidelines. So while that may not disqualify you from being awarded, we would, after the fact, after you're awarded, work with you to adjust your budget or action plan to make sure that all the allowable expenses are meeting our standards for funding. So there's some little pieces there where we may work with you after you're notified as a successful applicant. And yes, thank you. Next slide. So going into the dedicated marijuana account, also known as DMA, it's done on a state fiscal year cycle starting July 1st through June 30th, and then it's a 2-year grant. We have about $320,000 per year for the dedicated marijuana account projects. With this, we do want applicants to be intentional with their budget. So while you can apply for up to $65,000 per year for a total of $130,000 over the 2-year period, you may realize that you don't need the full $65,000 to meet the number, to do the 2 or 3 cycles of programs throughout the year that you intend to do. It may cost you half that much. You may ask for a small amount for a grant to do kind of an expansion service for a CPWI site. So you can apply for up to $65,000, but you don't have to request the full amount. One thing to note is that money does not roll over between fiscal years. So you'll get your set amount for the first year, July 1st through June 30th of 2022, and then that same amount the second year, starting July 1st of 2022 through June 30th of 2023. So here's a list of some of the evidence-based and research-based programs snipped from the RFA directly. And these are dedicated marijuana account type EBPs, which means that they've been evaluated and researched to meet the needs of marijuana use prevention. Some things that might, that we've seen applications for in the past: communities that care, community-based mentoring. I'll make a note on mentoring in one moment. Things like Good Behavior Game, Guiding Good Choices, Incredible Years, Sport, Strengthening Families, Strong African American Families. So many of these are, implemented throughout our system already. The one note I want to make on mentoring is that if you are notified as an apparent successful applicant, you will have to complete a Mentoring Washington survey following that notification of award. And that survey is to deem that your mentoring program is indeed community-based. We, at this time, cannot support school-based mentoring with our dedicated marijuana account. So you'll fill out the survey, Mentoring Washington will review that, confer with our staff here at HCA, and work with you if there's any questions around your proposed mentoring program. The next slide has the promising programs, as well as the environmental and information dissemination programs for dedicated marijuana accounts. So again, we have things like Atlas and Alcohol Literacy Challenge, Families You Need Us. And then some of our environmental programs include policy review, purchase surveys, and then we have social norms marketing, which is an information dissemination activity. I do see a question, is a grant limited to these programs? For dedicated marijuana account, yes. If you're applying for DMA, you are limited to the programs that are listed on these slides and in the RFA. The reason for that is our dedicated marijuana account funding is a state legislative budget item where we have to have a proportion of evidence-based programs with that funding, and so we don't have a ton of wiggle room to do any sort of alternative or innovative programs with DMA. And then just to reiterate, the funding is $65,000 up to $65,000 per year. And it is 2 years of funding for both the DMA and MHPP. So going to the Mental Health Promotion Project, or MHPP, and the Suicide Prevention Allocation, same time frame, same overall maximum funding amount. However, we have a little bit more money that we can allocate out to communities for these grants. So we have $520,000 per year. So we'll fund, we may fund a few more sites based on that allocation. And so, yep, I think that's it on the slide. Next page. And so we have the evidence-based and research-based programs for mental health promotion listed here, as well as the promising programs that you can implement. In addition, applications for mental health promotion grants must include the one youth mental health first aid training with a maximum cost of $5,000. So you'll see that listed in the RFA for the MHPP site, as well as implementing a community awareness project during that project period. Applicants will choose if they will be doing the suicide prevention options that are an evidence-based program or research-based program or promising program, or if they're an innovative program that addresses specific approved risk and protective factors. So you'll also see those on the next slide, which are the domains for risk and protective factors that one might choose, and then you may have a program, an innovative program that meets those risk and protective factors. All right, I'm going to pause for a second. Okay, scope of work, thank you. So as you are working through this, you are required to implement the approved action plan that's located in each Exhibit C packet of the application. The action plan includes the approved programs from your list, either DMA or MHPP. The programs must be implemented as proposed in your project narrative, action plan, and budget. If there are any negotiations or project scopes that are negotiated with you after you're awarded or notified as an apparently successful awardee, we will update those formal documents for your contract file. But other than that, you have to implement as proposed in your RFA. That includes dates, timeline, scope, dosage, target audience, responsible parties, etc. Funds can be used to support program costs that include staff who are implementing or planning a program. They could be used for training to support the evidence-based program or other program. It can include implementation, reporting, and evaluation staff time. Once you're awarded, you will be required to enter your approved action plan in our online reporting system no more than 30 days following the contract execution. If you are new to our system, if you're a Type B applicant, do not worry. We'll be setting you up with plenty of trainings in your first month or two, and many months thereafter, to get you acquainted with our online reporting system. you will be assigned a prevention system manager to support you through that and get you acquainted with through all of those trainings. And then following that first month and every month thereafter of the contract period, it is required that you enter program and service data by the 15th of the following month. For example, if you did a parenting class in August, that service data, which means participant names and information, surveys, demographics, all of that is required to be in the system by September 15th, which is the month following. In addition, we hold learning community meetings every other month. During legislative session, we tend to hold a few more just to update all of our prevention providers on what's happening in the legislative world. And those are required for attendance for all CBO grantees. In addition, you do need to attend a monthly check-in call with your prevention system manager, who will be assigned soon after the notification of award. There's also some required trainings that we will have you go to if you are a Type B applicant to ensure we can get you up to speed with learning some of the prevention systems here at DBHR. Just a few more slides before we jump into some Q&A. So before you begin writing your application, identify if you're a Type A or Type B applicant, and then identify if you're applying for DMA, MHPP, or both. Yes, you can apply for both grants. So if you're a Type A applicant, you can apply for both DMA and MHPP. And if you're Type B, you can do both as well. Just remember thinking through saturation of services, not overcommitting to too many programs in one community to make sure, that all of those services happen in a coordinated way, keeping that in mind if you're applying for both buckets of money. The application consists of the following pieces. You have a face page. There's a funding source packet, which includes the program selection form and a project narrative and an action plan. There's also a budget, and then you can provide letters of support. One moment, thank you. And then we have project narrative. Applicants must prepare separate project narratives for each funding source that they are applying for. For example, if you're applying for both the DMA and MHPP grants, you're required to submit 2 project narratives. The reason why is there's some questions that differ between DMA and MHPP that we want to see answers to. Each project narrative, without the letters of support, may not exceed 10 pages. Project narratives exceeding the page limit might be disqualified from further consideration of the application. Now we have your action plans. So complete those in the order presented. You do need to submit a different action plan for each funding source. So one for DMA and one for MHPP if you're applying for both grants. And the action plans will be scored on how well you complete the table that outlines those programs and strategies. As I mentioned earlier, Type B applicants have a different action plan template than Type A applicants. And again, that is for equity reasons because you may not be completely familiar with some of the language that we use in our regular prevention action plan. And so we want, to decrease some of those barriers. So just keep an eye out for that if you're a Type B, that some of your questions, that action plan template will look different. Now we have our budget. So budgets are in Exhibit C, and again, must be completed in the order presented there. You also have to submit a separate budget for each funding source project. So if you are applying for both grants, 2 budgets are required. Budgets will be scored based on how well the applicant answers the questions, and they must reflect the cost of programmatic activities that are aligned with the proposed population reach. So we will consider some cost variances of programs that are relevant to the proposed population reach and those potential impacts for those programs. Again, I reminded you earlier that you do not need to apply for the full $65,000. You may simply ask for $10,000 because that's the amount that's truly needed to do a couple of cycles of a program in your community because you already have an existing infrastructure and support, and you don't have to do an extra training. So just keep that in mind as you're creating your budget, and as you're looking through maybe shifts to virtual programming. I know we're kind of all still in that mode right now, so some of those costs may differ than usual. We also provided a helpful budget planning sheet for anyone new or existing that wants some help with budgets to take a look at, and that's in the application packet. And we hope that's a helpful addition to this RFA this year. And then remember to follow state guidelines for allowable expenses. There is a link in the RFA regarding those. Evaluation and scoring. So you'll see here the breakdown of points available, and then the priority points available as well if you're serving a high-need community or if you're working with an existing CPWI coalition. And last slide before we jump into questions. Please submit in writing all questions. Please do not talk to any of your existing state staff colleagues about this. They need to go in writing to this HCA procurement email. Questions are due each week by Thursdays at 4, and by Monday at 5 of the following week, we will respond to all of those. We know that provides a little bit of a delay, but we hope that between this webinar and then those weekly responses, we can get you the answers that you need before the due date on the 26th. So for now, we have 25 minutes left of this RFA. I see a bunch of questions in the chat. Some may or may not have been answered. So I will take a few minutes, look at those and answer those. And I will also be looking for some hands that are raised if you have any questions. Please keep in mind, I will attempt to answer as many questions as possible between now and 3:30. But this webinar is recorded, so I will be pausing in between them to collect my thoughts before I do respond. And if I don't get to your question today, we will make sure that is in writing on the next posting by next Monday that goes out. And some of that may mean there might be some follow-up that's needed before we answer that today on the recorded webinar. So give me a moment. Let me take a peek here at the questions, and I will be right back. Just to do a recap of some of the questions that did come in that I will reply. Are institutions of higher education eligible? Yes. Would Guiding Good Choices count as a mental health promotion program? And yes, Guiding Good Choices is on the list of evidence-based programs for MHPP programs. It is a maximum funding of $65,000 per funding source. We've got a few funding questions, so hopefully those have all been answered. One agency may submit an application for both CMA and MHPP. Yes. Okay. So one of the questions was, is the applicant defined by CPWI coalitions or by the fiscal agent? So if you are applying, let me say this differently. HCA will recognize a coalition as an organization, understanding that you have to use a fiscal agent to receive those grant funds. So an organization that may be acting as a fiscal agent for multiple coalitions would be allowable in that sense. Knowing that each coalition can't receive more than one DMA and one MHPP grant per coalition. I hope that is answering that question for you. Be right back. The next question is, if we are approached by multiple organizations who want to partner with our coalition, Can more than one organization affiliated with our coalition or high need community apply for a grant? I'm trying to work through that situation in my head. One moment. I believe that answer is yes. So if you're the fiscal agent, you can be the fiscal agent for multiple coalitions, but each high need community or coalition cannot receive more than one DMA or one MHPP grant. There's a question around numbers of individuals served, keeping in mind equity of rural communities, knowing that there may be a similar cost for implementing an evidence-based program in a rural community as it would in an urban community. However, the number served would obviously look drastically different in a rural community. We understand that. We will keep that in mind. I apologize if that was not clear. We want to focus on making sure we're reaching those highest need communities, reaching those geographic places through these programs. And we will absolutely keep in mind that number served isn't always a reflection of the program, but also the community in which it's being implemented. There was a clarification earlier on the DMA list. Thank you for our community member who pointed that out. DMA-funded programs have to show evidence of reducing the marijuana use and be demonstrated to be cost beneficial by WISIP, the Washington State Institute for Public Policy. And so that is why it is a smaller and very specific list to the DMA money, and we cannot have we don't have as much flexibility like we do on the mental health promotion list in that sense. I'm going to pause for a second on questions, and I see Marlene has her hand up. Do you want to come off? Heidi, you can unmute her. Oh, hands down. Never mind. Diana, you have your hand up. However, I don't think you have entered your audio pin, is what I'm seeing. I just sent you your pin, so let's give you a moment. Diana, maybe your hand's down. Not sure. Let's see. Now let's try that.
Can you hear me now?
Yes.
Okay, so sorry about that. So my question is in regards to Fiscal Agent. If we have two CPWI coalitions, they apply for these funding separately as their own entities, but would we, if as an organization wanted to apply ourselves, would that be an applicant A or B, is my question.
Yep, I would say A because your county already has an existing HCA DBHR grant.
Okay, but it is possible then for us to also separately apply for these funds?
If it's a different community that's being served, yes.
Okay, thank you.
Looking for other hands that are raised. Joe, you're up.
Oh, hi, thank you, Alicia. So my question is with regard to the MHPP grant. Previously, applicants were forced to choose between mental health promotion programs or suicide prevention programs. I'm wondering if I can request MHPP funding to do both mental health promotion and suicide prevention on the same grant, or are those still segregated? I can do one or the other.
It's and or. So you could do mental health promotion program options and or suicide prevention program.
Thank you. That's all I wanted to know. You made my day.
Great. I'm seeing a question about youth mental health first aid. So on, I think it's page 20 of the RFA of the MHPP funding source packet, you'll see that we have applicant must implement at least one youth mental health first aid training per year, a minimum of 2 youth mental health first aid trainings during the whole project period, with a maximum cost of $5,000 per year to go towards that training. Hopefully that answers your question. Okay. Go back up to the top. Sorry, folks. Lots of questions in here. Kat, yeah, I'm going to take you off mute.
Hello, Alicia.
Yes, you have a, oh, yes, hi.
Hi, this is Katya. So I can't tell if my question is showing up in the question section, so I figured I'd ask it online. Or
Okay, it probably is. There's just a lot.
So I was wondering for MHPP, we're considering applying, and as you know, we have multiple locations that are all coordinated by the statewide association. Would our individual locations be able to choose? There's a list of evidence-based programs, and so I'm wondering if we could have a handful of organizations using one program and then others, maybe 3 or 4 using another, and so having a combination of several EBPs under one proposal. Is that okay?
Yes, I think that would be acceptable. It says it could be a combination of evidence-based programs that are proposed.
Okay, excellent. Thank you.
You're welcome. Still working through questions, folks. Sorry about that. Okay, there's a question if the funding source can support the purchase of tablets or hotspots for participants to be able to join workshops virtually. Yes, that feels like an appropriate cost as long as it's reasonable and explained as an allowable cost for implementation. It would be similar to some requirements around food. There's, limits to what food costs could be for implementing a program. It would be kind of considered a supply for that program to be hosting virtually. There's a appreciation for increasing the annual maximum from 20,000 to 65,000. You are welcome. There's a question around an application that includes a CBO or CPWI in partnership with the university. Who should submit the application? I don't think that we would hold weight to an existing application or an existing applicant versus a new applicant if the university would be new. I think whatever makes most sense for your entity, who would be the primary applicant in that sense. So I don't think that there's a requirement on who would apply. You're both eligible. Let me clarify. If the CBO or CPWI is not a 501c3 and is therefore not eligible to apply on their own, then the university would have to be the primary applicant. Okay, somebody is a type B applicant Welcome to our system, hopefully. Did you say that names of participants are to be entered into Minerva? Is the question. Yes, for individuals over the age of 10, for direct services and training, we require that participant names are added into the system for every service that's entered. So you may do a parenting class and you will have a sign-in sheet, and then those participant names go into the system. However, that information is secured and confidential. We don't actually see participant names on our end. We see codes and numbers to protect those individuals confidentially from participating in programs. Hopefully that answers your question. There's a question on the limit for letters of support. There's a maximum of 6 letters per applicant. Ryan, I'm going to unmute you for a question. I think you're self-muted. There we go.
There we go. Yeah, mostly I'm just wondering about mentoring practice. So we run a school-based and community-based model, and I'm hoping that we can work alongside you guys to qualify that. And that, it sounds like for the DMA funds, school-based mentoring does not qualify. What qualifications does community-based, or what qualifies a community-based model?
I would say the primary difference between community and school-based, and it's kind of an evolving conversation our agency continues to have, but the primary difference is that community-based mentoring happens outside of the school hours. So school-based mentoring will happen like during lunch or recess, or but the community-based mentoring is happening outside of that school setting. Some other things that may distinguish the differences too are how individuals may be recruited or where the mentors are coming from. Sometimes it's, you know, business leaders and community partners that are the mentors to that community side versus a high school to a elementary school student. Those are kind of how that's classified.
So is there
there's
wiggle
also
room?
some, we cannot support school-based mentoring.
At all. So if I guess my question is, if I have community-based mentors, like you said, business leaders, mechanics, folks down the road that are doing mentoring on the property with students, that qualifies as a school-based program.
If it's happening during those school hours, yes.
Gotcha. Okay.
Yep. But there is definitely still some support that we can offer applicants in regards to getting technical assistance from our Mentor Washington partners upon applying and evaluating those programs. So there's some work that we can do.
We have community-based practice as well. I was just intrigued and wondered with the MHPP funding that we can do school-based mentoring with those funds, but it has to be educators, correct, or staff?
Is
that what I thought I read that?
That is a good question. I may need to follow back up with that in writing.
Okay, thank you.
Ryan. Yeah, of course. So one question is, how much funding for staff is available or allowable in MHPP grants? That question probably also applies for DMA grants. So there's not a limit to staff time. Again, there may be applicants who apply and they've already done a facilitator training and they have the people in place and they just need to implement. So therefore it's staff time. You already have curriculum bought. You already have the supplies. Now you're paying for the staff to do the service implementation. So there's not a percentage or a cap on that. There is a 8% administrative indirect cost limit, but that includes kind of all the overhead expenses, not the staff time to implement. So it kind of varies. That's a hard question to answer and be like black and white on. So there is someone's asking, there's funding source packets for both DMA and MHPP, attachments B1 and B2, and that's where you can find the list of approved programs. Someone's asking about the budget period. So you will get, this is a 2-year grant. So July 1st, 2021 through June 30th, 2023. So you'll have a year 1 amount and you'll get a year 2 amount in an awards and revenues pages if you're awarded this grant. We will post the amended high need community. Oh, there's no current amendment to the high need community list. That is, there's no amendment at this time to that. There is going to be an amendment to the CPWI community list, and that will be posted by the end of the day today. Someone also mentioned that one of the programs on the DMA list is called Pax Good Behavior Game. There is an open house scheduled next Tuesday, March 9th from 9 to 11, and it's an opportunity to learn more about Pax. If you're interested in that, I just wanted to mention that. And you can find that on the athenaforum.org. That's where we post a lot of our community trainings. We are not hosting it, but it's out there if people are wanting to learn more. That's a very commonly implemented program. So there's a question about the mental health first aid cost. So applicants have to implement 1 youth mental health first aid training per year, which is a minimum of 2 over the 2-year period. The cost is a maximum of $5,000 per each training. So you can do multiple workshops if it costs you less, but you can't spend more than $5,000 in total on that. Oh, I guess we are ourselves hosting the Pax Open House. Apologies. So we'll post that link here in the notes when this goes out where that could be found. So I acknowledge it. It's 3:25. I'm going to do another scan for questions. Hands up. Anything? Any other hands? Last call for questions. Okay, Jackie, I am unmuting you. Oops.
Put it in the question box. Just wanted to find out. I heard you mention you want a balance between Type A and Type B applicants. Was that done previously? And if so, what was the ratio like? Did you get more Type A versus Type B, or anything
That's
that?
a good question. Yeah, this is actually the first year we're trying this out. So in previous years, you've seen things that are like single site, multi-site. We got a ton of feedback the last RFA round that was not super helpful to communities applying. It was pretty complicated. So our team is trying something new this year. Obviously, we are always open to feedback if it does not work, but trying to have a balance between providing equity and access to new applicants joining our system, expanding those prevention services in high need communities, and also supporting our existing contractors to expand on their prevention work that they're already doing. So there is not history on this yet, and we will learn a lot from this year's RFA and always learn and improve along the way.
Okay, thank you.
Diana, I'm unmuting you.
Yes, I'm wondering, is this at all coalition based? So if there's a new community that's listed and this funding goes to them, will they have to create a coalition?
Oh, that's a good question. We had that last year. Somebody inadvertently applied and started a coalition with this CBO money. So no, it is not an expectation to create a coalition with this. This is independent of other CPWI RFAs that we will be having go out the door later this spring. This is independent of that. So this is just community-based organization money. It's a smaller bucket of money to support prevention services and that direct implementation. there is no expectation to start a coalition. That being said, there is one of the strategies is called Communities That Care, and that is the model for which CPWI was built off of. So you are welcome to use this money to start a new coalition using the Communities That Care / CPWI model to get that started if you are inclined to do that. All right. So we are going to wrap up this webinar today. Again, we will go through all of the questions, make sure that there is an answer to them, and it will be posted by next Monday. Thank you all for attending. We really look forward to seeing your applications come through. Really excited to be able to continue these prevention services out there in your communities. And if you have any questions, please email the HCA Procurement's office, and we will make sure that those questions get answered for you by next Monday. Thank you again, and we look forward to seeing your applications come through.